Hey there, tooth troubadours and gum guardians. Welcome back to Tooth Matters, where every tooth counts. I'm your host, Dr. M. And today we're tackling something every single one of us hopes never happens. But let's be real, life is full of surprises. What we are talking about here today is literally a pain in the mouth and various other dental emergencies. Whether you bit into a popcorn kernel and heard a crack, or you woke up with a swollen face that makes you look like a chipmunk on steroids, you're in the right place. How about we talk about another alternative, the dental first aid that we can do at home, because knowing the immediate steps can literally save your tooth and even potentially decrease your dental treatment time. Today we're covering what counts as a real dental emergency so that you can respond accordingly to it, what to do before you get to the dentist to protect your teeth and yourself, those dental emergency situations when you should go to the ER as soon as possible, lastly, what to do if your tooth literally flies out of your mouth. Yep, we've all seen those contact sports disasters. In a world where teeth betray you, one has to decide, is this a true emergency or just a cavity with an attitude? Okay, jokes aside, not every toothache is a full-blown emergency. Let's break it down. An absolute dental emergency is anything that involves severe pain or toothache, bleeding that won't stop, infection or swelling, a knocked out, cracked, or loose adult tooth, trauma to the mouth or jaw, abscess or pus, and what is not a dental emergency but still need a dentist. Minor toothaches or sensitivity, which comes and goes, lost fillings, broken braces wires, annoying but not dangerous, small chips that don't hurt. Let's talk about the most common dental emergencies and how to handle them at home. First, tooth knocked out or avulsion. If your adult tooth gets knocked out, don't panic. Well, okay, panic a little. Then do the following. Break it down into various steps. Find the tooth. Pick it up by the crown, not the root. That's the hard white chewing part of the tooth made up of enamel. Do not touch the root. The root has delicate cells and fibers around it that are vital for successful reattachment of the tooth back into the socket. It's like handling a tiny, precious dental baby. Do not scrub it. Rinse gently with water. No soap, no scrubbing, no harsh chemicals. We're just trying to gently clean it. Try to reinsert it into the socket if possible. Indeed, you heard correctly. If you can, gently push it back into place and hold it there with your fingers or by biting down gently on a piece of gauze. This sounds wild, but it's the best chance for the tooth to survive. In case you are unable to do this, then place it in either a cup of cold milk or your own saliva, or even your cheek pouch, as your own mouth is tooth-friendly. The saliva in the oral cavity will keep it moist till you reach the dentist. Go to a dentist within 30 to 60 minutes. Every minute counts. The faster it's reinserted and fixed, the better the chances of saving it. This is definitely not a I'll call them tomorrow situation. The second major emergency is severe toothache or the toothache terror. Here we're talking 10 out of 10 pain. Can't sleep, can't think, can't even Netflix binge. It starts as a little twinge, then becomes a throbbing beast that keeps you up all night. The pain goes to your jaw or sometimes even the opposite jaw. Follow these steps. Clean your mouth by rinsing with lukewarm water. Gently floss around the aching tooth to remove any lodged food particles that might be causing irritation. Sometimes that's all it takes. If there is no relief, then move on to step 2. Cold compress for swelling. If there's any swelling on your face, apply a cold compress or ice pack to the outside of your cheek for 20 minutes on, 20 minutes off. Step 3 should be pain relief. Over-the-counter pain relievers can help manage the discomfort. Follow the package directions. Step 4. Try to give temporary relief. Some people find relief from dental numbing gels like Oragel, or even a tiny bit of clove oil applied with a cotton swab to the tooth, not the gum. Big warning, never put aspirin directly on your gum or tooth. It can burn your gum tissue and cause permanent necrosis. Step 5 should be to call your dentist. A toothache is your tooth screaming for help. It usually means there's an underlying issue like a cavity, infection, or cracked tooth that needs professional attention. Don't just mask the pain, fix the problem. The third dental emergency is a broken or chipped tooth. Say you're munching on popcorn, enjoying a casual Tuesday, or maybe you chomped an olive with the pit still in it, and crunch. Oh no, that wasn't a kernel or pit, it was your tooth. Follow these steps. 1. Don't panic. Easier said than done, I know. 2. Collect any pieces you can find. Yes, seriously, even tiny fragments. Put them in milk, or better yet, your own saliva in a clean container. Why? Your dentist might be able to bond them back on. It's like dental superglue, which dentists can use to fix the tooth. 3. Rinse your mouth. Use warm water to clean out any debris. 4. Manage the discomfort. If it's sharp and cutting your tongue, you can try covering the sharp edge with a piece of softened sugar-free chewing gum or dental wax. Use a gauze piece if bleeding. For pain, an over-the-counter pain reliever like ibuprofen can help. If it's a small chip, you can probably wait a few days. Crucially, call your dentist immediately. Even a tiny chip can expose sensitive dentin or lead to further cracks. They'll advise you on the next steps. Remember, time is tooth. The next emergency is dental abscess. An abscess is a painful, pus-filled infection which can be of 2 types. That can occur at the root of a tooth, periapical abscess, or it can be in the gums, periodontal abscess. It is often accompanied by swelling in the face, jaw, or neck, fever, and persistent pain. Do these immediate steps. Rinse with warm salt water frequently to help draw out pus and soothe the area. Do not pop the swelling. This is an infection. Think of it like a nasty pimple inside your gum. Take pain meds, over-the-counter pain relievers like ibuprofen alternated with paracetamol or Panadol. See a dentist as soon as possible. Abscesses can spread infection rapidly, potentially becoming life-threatening if left untreated, leading to conditions like cellulitis and sepsis. They require immediate antibiotics as well as incision and drainage by a dentist. And in case you have swelling in your face or neck and difficulty breathing, swallowing, go to the ER. Like right now? What about that sinking feeling when a filling falls out or a crown comes loose? You're eating something sticky and suddenly you feel something hard in your mouth that isn't food. Step 1, don't panic. Step 2, if you have the crown or filling, clean it and the tooth it came off of. You can try to temporarily re-cement it with dental adhesive from a pharmacy, or even toothpaste in a pinch. Just make sure it's facing the right way. Do not use super glue. We're talking about your body here, people. Step 3, if it's a lost filling, you can use a temporary filling material from a drugstore. It's like a little plaster for your tooth until your dentist can see you. Just keep the area clean and avoid chewing on that side. This isn't a long-term solution. Your tooth is now exposed and vulnerable to pain, sensitivity, and further damage. Even if it's a root canal treated tooth, the part of the tooth left in the mouth is more liable to break without a moment's notice. Call your dentist and get that bad boy fixed for good. So there you have it, folks. 5 major dental dramas, 4 sets of crucial steps to take before you get to the dentist. Remember, these are hacks for immediate dental first aid, not long-term solutions. Always follow up with your dental professional. Another emergency which is less talked about but definitely needs a mention is bleeding gums, especially if the bleeding is persistent or heavy. While occasional bleeding during brushing or flossing can indicate gingivitis, persistent, heavy, or spontaneous bleeding that doesn't stop can be an emergency. Rinse gently with cold water, as the cold can act as a vasoconstrictor and can help in stopping the bleeding. Apply firm but gentle pressure with a clean piece of gauze to the bleeding area for 10 to 15 minutes. Avoid vigorous rinsing or spitting. All this could indicate advanced gum disease, a laceration, or an underlying systemic issue like a blood clotting disorder, or it could even be the side effect of some medication. Any persistent bleeding requires professional assessment. Knowing what to do can make all the difference between saving a tooth and saying goodbye to it. So be prepared, stay safe, and keep those smiles shining bright. Additional dental emergencies which could possibly be tackled at home could be tooth sensitivity. Just brush, floss, and clean the area. Apply a sensitive toothpaste to your tooth in a massaging action. Repeat after some time. but call the dentist if this persists. Another common emergency is when an object like popcorn gets caught between teeth. In such a situation, try to gently remove it with floss. Use warm water to dislodge it. Do not use sharp objects like toothpicks, pins, or knives, as theirs can damage gums or enamel. You might even be able to brush it out the next day, if not immediately. You could have a sharp tooth or a restoration causing soft tissue ulceration. Try to cover the sharp edge with a small piece of softened sugar-free chewing gum or orthodontic wax, if available. This creates a barrier between the sharp point and your delicate soft tissues. Over-the-counter topical numbing gels can help, and definitely contact your dentist to sort this out. When to go to the emergency room? A dentist can handle most tooth traumas, but there are red flag moments when it's ER time. Rush to the ER if you have any of the following: swelling, which affects breathing or swallowing. You have a high fever with facial swelling, have jaw fractures or major trauma, or you have uncontrollable bleeding. How to prevent dental emergencies? Most dental emergencies can be prevented. Brush after meals and floss like a boss. Wear a mouth guard during sports. Do not chew ice, pens, hard candies, or even chewing gums for too long. Sorry, jawbreakers. Keep up with dental checkups and cleaning every 6 months. To wrap things up, 5 major dental dramas, 5 sets of crucial steps to take before you get to the dentist. These are hacks for immediate first aid, not long-term solutions. Always follow up with your dental professional. Dental emergencies might be scary, but now you know what to do if one strikes. Remember, stay calm, protect the tooth or what's left of it, and see a professional as soon as possible. Knowing what to do can make all the difference between saving a tooth and saying goodbye to it. So be prepared, stay safe, and keep those smiles shining bright. If you found this helpful, smash that like button like a molar hitting caramel. Don't forget to subscribe for more practical health tips and hit the bell icon so you don't miss out. Have you ever had a dental emergency? Tell us your horror story in the comments below. We might feature it in our next video. Check out this next video on tooth matters. Hopefully it might help you sometime, somewhere, someday.